So far, the news that I'm getting from India is reopenings have started to happen across the nation, and New Delhi, after a strict 5-week lockdown, has opened shops and malls and is allowing restaurants to have 50% seating and 50% capacity on suburban railway networks and more. My first question to you is, what's happening in India? Do you think this reopening that is happening across India is a wise decision?
Again, I can only give my own opinions. Not being there and not taking care of patients there, so it's sort of, I'm a step removed. But it's mind blowing to me that India would think to be reopening so quickly after quickly jumping to becoming, I believe, the world's leading the world, and I think the third most deaths in the world from COVID. And I think the numbers are likely a lot higher than that. So from an outside perspective of a physician looking into a country that has just been seen a massive uptick in COVID cases, it seems a little irresponsible to me to be opening up so quickly.
Right, and India is still seeing about 3,000 or above deaths, daily deaths, and it's now decreasing in numbers for new COVID-19 cases. However, this disease has now spread to rural parts of India where perhaps the cases have not been counted. How are you observing this number, and do you think the numbers that are coming in are just a huge undercount?
So it's important to note that during the peak of the COVID crisis here in the United States, we were seeing about 3,000 deaths a day. That was in like December, January timeframe. And so, if India is reporting that they are losing about 3,000 individuals, people, 3,000 people a day, I personally feel that number is likely very underreported, and I know that a lot of people and a lot of organizations have also made the same comment that India is likely underreporting not just the number of COVID infections, but the number of COVID deaths. And really, they don't have the infrastructure to go out and actually measure all the COVID infections, and nor do they have all the infrastructure to take care of the surge in COVID infections and deaths. So, I as well as I know a lot of people have friends and family in India, so we're in touch with them on a regular basis, almost every day. We hear from them, and the reports from from their accounts from all over India is that, look, there's still people are having difficulty in getting their loved ones cremated. They're still finding difficulty in finding hospitals for their loved ones that do come down with COVID infection. So just there's some simple things that you can look at that tell you that India's really not ready to open up just yet.
How long do you expect the devastation across India to continue? What are some of your predictions on this?
That is a very, very tough. That's a very tough ask. But if I had to make an educated guess, I would say that over the course of the next 3 to 6 months, the number of infections in India should slowly come down, just really as a natural response to increased number of vaccinations. And I know the world is mobilizing to help India and its people to vaccinate and build up medical infrastructure, including providing oxygen and oxygen concentrators. I know that the Sikh community and Gurdwaras in India are doing a fabulous job of helping to support some of that medical infrastructure. So we'll hopefully 3 to 6 months down the road be in a better place.
Right, but do you think India can vaccinate fast enough? Because it's 1.3 billion people living there. Vaccinating them, I don't know how long it will take.
Yeah, so it's definitely a challenge. So, you know, when firefighters are fighting a very, very large fire, for example, there's no way you can dump enough water on the center of the fire to extinguish it. So what you have to figure out is, you know, where are we going to make the line in the sand to hold off this fire? And so I would employ a strategy to figure out where am I going to vaccinate to make the most to provide the most effective relief in coronavirus transmission. The other complication of India having so many of these infections, just again spreading like wildfire, is that all these different variants are coming up, and there are multiple variants. I would imagine that are burning across India, which will eventually make their way around the world. You know, the Delta variant is one great example. The Delta variant has been seen in, I think, 74 countries around the world now, and it is highly infectious and very, very dangerous. And we're seeing an uptick of Delta variant COVID infection here in the United States as well.
Right, and I have more questions on that variant exactly, but right before that, I have one more question left for you on India. Prime Minister Narendra Modi has been criticized and has been called responsible for this devastating surge that India has seen, thousands and thousands of lives lost. The government opened India in January. They allowed for Kumbh Mela to happen, which saw millions of people together. They allowed election rallies to happen, which gathered thousands and thousands of Indians. How are you looking at this? What are your comments on this?
You know, I think healthcare decisions need to be taken with an eye of public safety and public health. That's how you manage these healthcare decisions. You never politicize them, or you never want to politicize them, because that's what will happen is the people will lose faith, or people will lose they'll lose faith in the process. So we need everybody to be vaccinated, regardless of political affiliation or who you support, or it should have nothing to do with politics. And so that is my my one major criticism among many of the Modi administration. Again, these comments are simply my own, and they don't represent those of DOD or the Army. I'll throw my disclaimer out there. But I think India's politicians are very much so to blame for the lack of infrastructure and the very, very poor response to COVID that's going on right now.
Let's now talk about the United States, doctor, because a lot is happening here. Today, we just surpassed 600,000 deaths in the nation. Meanwhile, cases and deaths are on a decline in the country. Reopenings are happening. California just opened up fully. My question to you is, with this Delta variant posing such a threat on the new cases and deaths related to COVID, is it still too soon to reopen California or other big states such as New York or New Jersey?
Well, politicians have to weigh the public's need, and there is definitely COVID fatigue that the public has had. And so as a way to sort of promote vaccinations, I believe many states, as well as the federal government, is saying, look, you can go out and you can do things like we used to do as long as you're vaccinated. And I think more and more businesses are starting to say, okay, you can do this, you can do that, as long as you are vaccinated. And I think that's a reasonable thing to want to do, especially over the summer. But do I think that we will pay for it in the fall? Absolutely. we cannot expect that we will have this sort of summer of fun, unmasking. We're going to have all these weddings and these large events, and people are going to go out and have fun without paying a price for it. So there will be an increase in number of infections as we go through the summer and then into the fall, and then I anticipate that we probably will see a surge again in the fall or the winter of this year, because of all these different variants that are out.
Will this surge be similar to the surge we saw after summer last year?
I don't think so. Again, this is nobody really knows. But the concern is that these variants potentially could come in, and they may be more infectious, they may be more deadly, and they may still continue to mutate into something that we may not be able to control. Right now, it seems like our vaccinations are slowing this down, and the number of hospitalizations and bad infections that we're seeing are all down significantly, to the point where I think here in New Jersey, our infection rate is about 1% or maybe a little bit lower. That's amazing. In some places where I worked, I mean, the infection rate was as high as 15 to 20%. So we're, the caseload of infections has gone down significantly, and that's amazing. Governor Phil Murphy here in New Jersey has done an amazing job, and we're lucky in that we are approaching we're approaching that 70% mark very, very soon nationally. I think we're at 64% for adults right now.
Right, and just talking about vaccinations, about 64.4% of U.S. adults have been vaccinated with at least one dose. However, there are several states in the South and the Midwest that have very low rates of vaccination. My question to you is, if we do not reach 70% of people with at least one dose of the COVID-19 vaccine, what happens then? Because a lot of these anti-vaxxers and about 29% of Republicans are saying that they will not get the vaccine. What is the repercussion of that?
They are likely going to get infected. Not just infected, but they will harbor and become a reservoir for this COVID infection. And they will likely spread it to the rest of their friends and family and the American public. This is not politics. This is solid science that shows that if you are vaccinated, you are much less likely to pass on the infection. You're much less likely to get infected or get hospitalized or die from this. So it's important we do this as a public safety initiative for our friends and family, for my grandmother and for my kids and for all the adults that have a variety of conditions, medical conditions that predispose them to a bad COVID infection.
Definitely. And White House advisors are actually saying and strongly recommending that these unvaccinated people consider getting vaccinated, especially because of the Delta variant. Now, let's talk a little bit about what's happening in vaccination with children. 12 to 15 have begun to be inoculated. Great news for us. Pfizer is doing a great job. Moderna is on its way to get approval for that as well. They're now doing trials for children in the ages of 5 to 11. I'd like to know, how are you looking at these trials? And they are saying that they're going to give a lower dose of the COVID-19 vaccine to these young children. How will that be determined? And for parents that are worried about getting their kids vaccinated in that age group, what do you say?
Yeah, I think these concerns are valid. Whenever you administer a vaccine or a medicine or anything to your kids, you want to make sure that you do it in a safe manner. And that's why my kids who are 12 and 13 will be getting their vaccine very soon. They'll be getting the Pfizer. And, I think it's important that we continue to look at safety data, continue to do these trials as we start to administer vaccines in the 5 to 11 age group as well. I know we have good data coming in from Europe and other parts of the world where they have vaccinated young kids, that they have not seen many complications and that they've been able to do it safely. Now, in terms of dosing, I do agree that a smaller dose may be better. Whenever you dose kids, it's with medications, it's usually based on their weight. So it's probably a good idea to change the dosing of kids based on the fact that they're much smaller size. So they may not need as much to generate the same immune response.
Do you think these schools across the nation will be able to open up if we get the approval for 5 to 11 as well?
Yeah, I believe so. And I think we can do it safely. I think a lot of parents are actually looking for the vaccine so that they could, so that life can start to return back to normal. I know a lot of parents love working from home, but I know a lot of parents can't work from home. They still have to go in. Like I work in a hospital, so I've despite my asking, they still want me to come in. I've asked them if I could FaceTime, but they and I'm just joking there. Of course, you want your doctor in the ER and at the hospital, but I think in order for us to sort of find a semblance of normality, we are going to have to start to vaccinate children again. Otherwise, what will happen is they will simply become the reservoir for all these infections, and they will generate these variants, which at some point will break out and to the larger public and start infecting the larger public.
Basically, anybody who is unvaccinated could spread this disease and make it, very harmful for themselves as well. When you are looking at these schools, doctor, do you think masks should still be required?
I think it's still a good idea for masks to be required at this point. Now, in the fall, if we reach a certain threshold where, let's say 70 or 80% of the school kids are vaccinated, I think at that point we can look at the data and say, hey, do we really still need to mask as long as we have good ventilation and as long as we have some social distancing within the classroom? Those are conversations we'll have to revisit after we figure out exactly what percentage of students are vaccinated. And it's better for the CDC to just give guidance and let states and state governments sort of make these decisions on a state-by-state level.
Right. 2 more questions left here for you, Doctor. The White House is saying that they will host now a July 4th celebration to mark independence from this virus. Your comments on this, and what should this celebration look like?
I think it's wonderful to celebrate all that we've accomplished, since President Biden took office. I believe that we have almost hit a major milestone. We've almost hit that 70% mark in terms of percentage of public that's been vaccinated. I think that's something worth celebrating. I think the fact that we are donating 500,000 doses of COVID vaccine to developing countries is also something that is worth celebrating, because we can't simply hope to fight COVID alone here on American soil. We have to do it globally. And that's because, there are these other variants that will be generated, and we have to defeat this infection globally. Otherwise, it's going to keep seeping back in and, infecting our public.
Probably one of the biggest projects ever that I have seen, these mass vaccination programs across the the world. I really hope something good comes out of it. My last question to you would just be asking you about a prediction for the next 2 months. What do you see happening here in the United States?
I believe in terms of COVID infections, I believe people are going to plan on opening schools in person this fall. I believe that we will have an enjoyable summer, and I believe more and more businesses are going to continue to open up and not make it a requirement to wear your masks. I think a lot of folks are ready to just sort of just take a knee is sort of a saying in the military, where you just you need a sort of a psychological and a physical pause before you prepare yourself for whatever it is that happens this fall or winter. So I believe people are going to enjoy this summer. They're going to go on vacations. They're going to have wedding celebrations, and I think there's value in that, especially when we can do it safely. So I look forward to a great summer, but I urge caution as we approach the fall and winter.